Polycystic ovarian syndrome, PCOS, affects women with the hormonal disorder in a variety of ways. Those who suffer with PCOS can experience ovarian cysts, weight gain, irregular periods, infertility, and a whole lot more. But one of the most debilitating symptoms isn't one often regarded as serious or severe: chronic fatigue. Experiencing chronic low energy levels is anything but an insignificant symptom. When you're overly tired, you lack motivation, you miss out on important events, and you're robbed of joy. When you're always fatigued, it's hard to ever enjoy anything that's happening in your life. You suddenly dread the job you once loved. Quality family time after school feels impossible. And no one should even think of inviting you to anything. You're too tired. PCOS directly affects your energy, but how? Today, we're discussing all things fatigue. You'll learn where the low energy comes from and how to relieve the symptoms. Let's get into it. Does PCOS cause fatigue? As we discussed, polycystic ovarian syndrome causes chronic fatigue, but it's not quite that simple. No one PCOS diagnosis is the same. Each woman experiences a different array of issues and symptoms. There's no single cause or treatment. So, before we jump into how to rid yourself of this burdening symptom, let's get into some reasons PCOS causes fatigue. Irregular sleeping patterns. This one's easy. If you don't sleep well, you'll be tired in the morning. If you suffer from sleep problems, you probably already know this is a contributing factor to your daytime fatigue. This is because sleep disorders are more common in women with PCOS. Women with PCOS are more likely to have obstructive sleep apnea, excessive daytime sleepiness, and other sleep disturbances. When you don't have a regular sleep schedule, you'll feel more tired. As sleeping issues worsen, your fatigue will increase too. Underactive thyroid hyperthyroidism and PCOS go hand in hand. The endocrine disorders are very similar, so it's not uncommon for women with PCOS to also have an underactive thyroid. When your thyroid is underperforming, it doesn't produce the hormones your body needs to thrive. This leads to dry skin and high body aches, weight gain, depression, hot and cold sensitivity, and, you guessed it, excessive tiredness. Iron deficiency, anemia, irregular, heavy periods aren't just annoying, but they're also bad for your health. The excessive blood loss can lead to an iron deficiency. And, when your iron levels are low, chronic fatigue follows. Low vitamin B12 or vitamin D. Vitamin B12 is a vital nutrient that produces energy in your body. Your cells use vitamin B12 to function. So, without the proper intake, oxygen delivery and red blood cell production are both hindered. Since your tissues aren't receiving the proper oxygen, you'll feel weak and tired. Additionally, vitamin D deficiencies have also been linked to chronic fatigue. Insulin resistance. Many women with PCOS struggle to manage their blood sugar levels due to increased insulin resistance. When your body is insulin resistant, it means it doesn't store and process glucose properly. It will store the glucose as fat, rather than delivering the necessary nutrients to your cells. This leads to weight gain and tiredness. Then, you'll feel especially fatigued after meals. PCOS medications. A drug known as metformin is often prescribed to women with PCOS to increase their insulin sensitivity and reduce androgens. Unfortunately, this drug has also been linked to vitamin B12 deficiencies. Talk with your doctor about obasitol. 15% off PRC code 292660, and consider taking supplements with B12. Thanks for watching. Please subscribe.